Hi, welcome to today's episode on Fast Intelligent Care, where we're talking about what is single-handed care. So first things first, single-handed care is not the only term that we would use. It can also be called proportionate care or optimized care. So in 2022, the National Back Exchange, which is mostly UK-based forum, they had a poll to look at the different terminology or words that you could use for single-handed care, which is basically going from always having multiple caregivers to having just one, or having one-to-one supports as your baseline. So some of the terminology that they would look at was reduced care handling, moving with dignity. Another option was right care for you. But ultimately, single-handed care still was the preferred term. So that is what most people will know it as. But optimized care and proportionate care is sometimes a bit better to use in terms of people's perception of it, because single-handed care does have a bit of a negative perception in some cases, because people think single-handed care is about just trying to save money. It's something that's not within what's not legal. It's not within their policy. They're not going to be insured. It's not safe. They might feel that it's just quicker and more time efficient to have two caregivers. So there are a few challenges in terms of the perception of single-handed care. So some will even say single-handed care is basically moving and handling with one-to-one supports as a baseline. So let's go into what single-handed care is definitely not. So single-handed care is not about saving money. It's not about just removing support workers for no reason. It's not replacing clinical judgment, but single-handed care is about still reducing risk to the caregiver and the client, but doing it through the design of the environment, the design of the task, having equipment to replace some of the tasks that the caregiver is doing. So it actually can actually have more of a benefit to the caregivers in terms of preventing injuries, because instead of now just having a blanket rule that we always need two people to do hoisting and just relying on two people potentially injuring their back, straining their body, we are now saying maybe, depending on our risk assessment, we could have just one support worker and one carer and have equipment to help them to completely, or as much as possible, eliminate the risk or reduce the risk as much as possible. So when we actually look at the legal framework, especially when we're looking at the Australian context, there's actually no law that you have to always have two carers for any manual handling tasks. The focus of the legislation and any practice codes relating to manual handling is that it has to be risk assessed, and it has to be where we try and eliminate or reduce risks as far as reasonably practical. So in some cases, what is reasonable and what is practical is to have two people, but we want to have the least amount of restriction but still have safety, because we still want to have our clients be as independent as possible. We want to involve them in the task. We want to maximize or increase enablement, but also have safety, efficiency, and dignity for the client. So an example could be someone who is lying in bed. They need to be hoisted with a ceiling hoist or a mobile floor hoist, and they need to be hoisted out of the bed to get onto the commode to go to do toileting. Now they have to wait for two caregivers to be available to actually assist them. So if they press the call button, for example, for a caregiver to assist them, one's going to come ask what they need. They're going to say, well, I need to go to the bathroom. That caregiver is going to say, well, I need two people to do hoisting, and now I need to go wait for someone to be available. Meantime, this client is potentially getting really uncomfortable. They have really urgency in terms of, I really need to go to the bathroom, and in terms of dignity and maybe the invasiveness of the whole procedure, we're taking a little bit of that away from the client. So what we want to do is we want to match the client support needs with what we're providing in terms of the amount of caregivers and the equipment, and not just have it as a blanket rule or just out of habit that we always use 2 people. Because there are some cases where we can just have one person assisting with the use of equipment. But a very important thing about single-handed care is that it has to be properly risk assessed. We need to have the right equipment in place, and we need to have proper, thorough training for caregivers, and they need to be confident and competent to assist. So if we do have caregivers or carers that don't feel confident to do single-handed care, that is something that we need to address before implementing it. But as a disclaimer, there will always be instances where 2 or more care workers or carers are needed. It's not for everyone, and only implement single-handed care if it's safe and appropriate to do so. So as a summary, single-handed care is implemented through a comprehensive risk assessment. It is something where we use equipment to minimize or eliminate risk to the client as well as the caregiver, and we are focusing on proper training and competency and confidence of our staff, and we are making sure that it is documentation driven and person-centered. Stay tuned for our next episode, where we will be unpacking how to assess if your client is suitable for single-handed care. If you want to find out more about single-handed care, go onto our app where we have a recording of a webinar that is focused on single-handed care. There's also more info on our website on CPD events as well as upcoming webinars, and stay tuned for our next episode. We'll see you every Tuesday